subscribe now and press the bell icon. Never miss an update.
Hello and welcome to Health Live at Seniors Today. Today is a special day. We are on July 15th, and 4 years back on this very day, Seniors Today had started. We are for today. Our fourth anniversary is just out, and at the end of the session today, we will give you a sneak peek into the magazine. Of course, it is there on the website already. And on this very special day, we have a special session, as always, as every session is special. We have gone from Bombay and Pune and Delhi to Hyderabad, and where we have Dr. Dilip Nandamuri, who's a senior diabetologist and a physician. I would love to introduce Dr. Nandamuri. Dr. Dilip Nandamuri is a senior consultant physician and diabetologist, as I mentioned, at the Yashoda Hospitals in Hyderabad. He specializes in the treatment and management of infectious diseases, diabetes, hypertension, high cholesterol level, lifestyle diseases, thyroid problems, osteoporosis, and inflammatory disorders. He has experience conducting phase 2-4 trials and is well known for his initiative and ability to work independently. With over 2 decades of experience, Dr. Nandamuri graduated in general medicine at Annamalai University, and earlier his MBBS from Mysore University. He's a member of leading professional organizations and has published several research papers over the years. We've invited Dr. Nandamuri to talk today about diabetes side effects and care. Dr. Nandamuri, how are you?
Good evening, everybody. Mr. Pradiman, thanks for your kind introduction. I'm good here. It's been evening and it's cold. It's not very hot nowadays in Hyderabad. The weather is pleasant on a Saturday evening. I look forward to speaking to all of you guys today.
Thank you very much, Doctor. So, Doctor, the topic that we've requested you to speak about is on side effects of diabetes. We've had quite a few sessions on diabetes so far, nothing specifically on the various side effects that are there. And I would request you to make a presentation that you have. And those of you who are there, as always, please watch the presentation, listen in, and post your questions in the Q&A tab. As always, mention your gender and your age. Remember, the question that you ask, do note that while Dr. Dilip Nandamuri will give you advice on what's what, but there's nothing that can beat a clinical examination, a personal clinical examination, that you should perhaps go for whenever. But of course, these days, thanks to COVID, post-COVID, doctors like Dr. Dilip Nandamuri are available for teleconsult, so you can always do that. But over to you, Doctor. We can start with the presentation and then we'll take the questions later.
Yeah, thanks, Pradiman.
Go ahead.
I'm trying to remove.
We can see it, Doctor. Yeah.
Okay, that's fine. No, I'm seeing our videos here. I'm trying to hide them. Yeah. Okay, good evening, everybody. Today we are talking about side effects of diabetes. Generally, people will talk about side effects of drugs, but we have named this topic as side effects of diabetes. Precisely, we call it as complications, or what are the effects of not controlling blood sugar properly, and how do we care about it? So what are the diabetic complications? So basically, diabetic complications are classified into acute complications and chronic complications. Acute complications are hypoglycemia, which is a person having a diabetes getting into low sugars. low sugars for diabetic we call it less than 70 milligrams per deciliter. And second thing is diabetic ketosis, where a person with type 1 diabetes or type 2 diabetes will go for a very high sugars, uncontrolled sugars, which will developing into ketosis and causing all sorts of troubles like multi-organ failure, death and all. And third one is same like a diabetic ketoacidosis, hyperosmolar non-ketotic state, which occurs in only in type 2 diabetes, not in a type 1 diabetes. This is also not here. The difference between diabetic ketosis and hyperosmolar non-ketotic is in hyperosmolar non-ketotic state, we don't have ketosis, but still the blood sugars are high, electrolytes will be disturbed, and they can be a multi-organ failure. These are the acute complications. Today, we're not talking about that acute complications. We're talking about chronic complications. Chronic complications are divided into macrovascular and microvascular. That depends on what is the size of the vascularity, arteries. So macrovascular complications are coronary artery disease in the layman's language. The patient developing heart attack, strokes, cardiac strokes is called as coronary artery disease. Cerebral vascular disease is basically a stroke in the brain where blood supply to the brain to certain parts of brain will be disconnected or stopped or reduced, which causes paralysis of certain areas of the body. Peripheral artery disease is a blood vessels which are supplying our peripheries, that is, especially in the legs. If that arteries become blocked or clotted or stenosed, stenosed means narrowing, you will get diabetic foot ulcers, neuropathic pains, and also gangrene, which may lead to foot amputations, knee amputations, or ankle amputations. Microvascular complications are retinopathy. What is retinopathy? Retinopathy is vascular complications leading to diminished vision or less vision or complete blindness in the eye. This is called retinopathy. This is problems for the retinopathy. Nephropathy is slowly increasing protein excretion from the kidneys, leading to increased creatinine and kidney dysfunction, leading to end-stage renal disease where patients may need dialysis or kidney transplant. Neuropathy is the blood supply to nerves of our body. We have millions or trillions of nerves. The blood supply to the neuropathy nerves with high blood sugars can cause damage to nerves, which will cause neuropathic symptoms like tingling, numbness, pain, and loss of sensations. So these are the basic macrovascular and microvascular. Macro is heart, brain, and legs. Microvascular is eyes, kidneys, and nerves. What are the factors affecting complications? As most of us know that diabetes is basically two types, majority, type 1 and type 2. Type 1 comes in children, type 2 presents in adulthood. If you see 100 patients with diabetes, only 5 to 10% of people will be type 1 diabetes, and rest all 85 to 90% are type 2 diabetes. In type 1 diabetes, at the diagnosis, we rarely see complications because it is developed in the childhood. So once patient develops type 1 diabetes, we see complications after 5 to 7 years of duration. But type 2 diabetes, a lot of patients get diagnosed as type 2 diabetes, coming to the hospital with certain problems like heart stroke or brain stroke or neuropathy problems or retinopathy problems or nephropathy problems or peripheral vascular disease. So most of the patients who develop diabetes in type 2 elderly people will have at least one of the complications at the time of diagnosis. And other risk factors for complications happening in diabetic patient is chronic complications is associated hypertension, that is increased BP, smoking, obesity, dyslipidemia, and also it is not mentioned is alcohol, excessive alcohol intake. Basically, chronic complications is vascular complication. It can be microvascular or macrovascular. If you see the video here, the circulation system, the blood circulation artery, initially it is clear. Slowly the fat is getting into the walls of the artery, slowly narrowing the artery. And next, if you see the second one, there is a blood leak causing a sudden clot, causing heart attack or brain strokes. These are vascular complications which I just talked about. Diabetes is more than just a problem of high sugars. A lot of people ask or have a doubt because of a lot of media and other things. Each one is putting some of their ideas about is it necessary to really control sugars or not. The question is, diabetes definition is the blood sugar levels are more in the blood and it's not getting into the cells, converting into energy, giving you proper energy. And wherever you have these high sugars, so blood is transported from every cell of the body. So if the high sugars circulate in every cell of the body, slowly it will damage the structures wherever the blood goes. So this vascular changes doesn't happen immediately. It takes time. So most of us doesn't know or doesn't appreciate or not understand that why we should control sugars values so strictly. Because if you don't control sugars so strictly in initial years of diagnosis, you may develop this whatever called as vascular complication, microvascular or macrovascular complication in next few years, and develop heart stroke, brain stroke, or kidney failure, and all those things. So to avoid this, we have to control the blood sugars. Do we see then why older people, older generation, 50, 60 years or 70 years back, people never bothered about controlling sugars? That time, the number of diabetic patients are also less because we had a more physical work than a mental work. So most of us are now sedentary workers. So whatever we eat, we are not actually using it for the whole day. So there is a storage of energy, which is causing obesity, insulin resistance, and increased sugar, which are leading to complications. Second thing, a lot of research was not available 100 years back that if sugars are more, what will happen in future. For a period of time, a lot of institutes, research institutes, countries have done taking people who are having high sugars and how they behave over a period of 10 years if they're not controlled and if they are controlled. What the study shows is, if you control your sugars well in the range, the complications may set late or you may not get the complications at all, like heart attack or stroke. If you don't control sugars, you'll be vulnerable to getting heart attack and brain stroke, kidney dialysis and all. So it is important we should continue the blood sugar control. So just to have rough numbers, what are the diabetic complications? Diabetes can cause complication. We have around nearly 20% of people having heart attacks, 6 to 7% are having foot gangrenes, peripheral vascular disease, retinopathy around 18%, nephropathy around 3%. With only 3% of nephropathy and patient going to dialysis, we are not able to give dialysis facility for each and every patient who needs it still in India. So a lot of patients doesn't get dialysis because we don't have enough machines also or enough doctors. So with 2% only, we are having this trouble. If it increases into 4%, it will be much more problematic. Neuropathy around 25%. So to avoid this complication, we need to control sugar. How does it happen? Pathogenesis of complications is hyperglycemia is a definition. It is increased blood sugar, which will increase the AGEs. AGEs, advanced glycation products, which will alter protein function, causing inflammatory response and complications. And increased sorbitol causes altered cell function, making complications. Like that, only increased DAG and fructose 6 phosphate also causes changes in gene enzyme expression, gene function expression, leading to complications, leading to macrovascular, microvascular complications. So we talk about diabetic retinopathy. It's basically a specific vascular complication in both type 1 and type 2 diabetes. Neuropathy refers to degeneration of peripheral nerves found in 50% of type 1 and type 2 diabetes. Presents as sensation of numbness, tingling, sharpness, or burning. Contributes to foot damage and ulceration. There is a visual show. Diabetic nephropathy is basically damage to kidney vessels and tubules, loss of protein in urine, leading to end-stage renal disease, needing dialysis or kidney transplant. And nephropathy is a major cause of illness and death. It's a progressive condition which leads to renal failure. Affects almost nearly 30 to 40% of type 2 diabetes patients. Death from end-stage renal disease and CVD is more when patient has nephropathy. And albuminuria, that is loss of protein in urine is the most important initial sign to see if patient is going to nephropathy or not, and see what are the measures should be taken to avoid this situation. The same thing. These are macrovascular complication, reiterating heart attacks, brain strokes, peripheral artery disease, and cardiomyopathies. So what do we do? How do you avoid it? Macrovascular complications management is first is stop smoking, maintain ideal body weight, avoid obesity, lower fat intake, exercise, good glycemic control, that is controlling sugars. It can be with tablets or insulin, doesn't matter. Treat hypertension with antihypertensive. Improve your lipid levels by diet and exercise or along with statins. It doesn't, not only statins, a lot of people feel that it has side effects. It can cause diabetes itself. Statins is not only used for reducing the blood cholesterol levels. It also reduces the plaque formation and also plaque stabilization. That means initial 2 slides we saw that in artery wall, slowly fat accumulates and then breaks. This breaking of artery, that is plaque breaking, can be avoided by using statins so that patient may not develop heart attacks or stroke. And aspirin is an antiplatelet, that is blood thinner therapy for needed patients. So basically, what I wanted to tell today is diabetes leads to many complications. It can be acute or chronic. How do we avoid affecting complications? 3 factors affecting complication is what is the duration of diabetes, how good is your blood sugar control, and what are the additional problems you have, like hypertension, increased cholesterol levels, or hypothyroidism, amiloidosis. And 3 acute complications, that is hypoglycemia, diabetic ketoacidosis, and hyperosmolar non-ketotic. Chronic complications are vascular mainly, microvascular and macrovascular. Microvascular are neuropathy, retinopathy, and nephropathy, that is nerves, eyes, and kidney. Macrovascular is heart, brain, and peripheral artery disease, that is legs especially. So it's important to care for those who once cared for us, is one of the highest honors. So elderly people, anyone who has developed diabetes, try to get their sugars in control. That ABC. ABC is A is HbA1c should be in control. B is blood pressure should be in control. C is cholesterol should be in a control levels. If we can do this ABC, we can avoid having complications for all the diabetic patients, especially in elderly people. I stopped the presentation here, and we can take questions from you.
Thank you very much, Doctor. Thank you very much for a brief and deep, a fairly comprehensive presentation. We have quite a few questions that have come in. Can we go to the questions right away?
Yes.
So this is from
yes, sir.
Dibendi Ganguly, who is, he says, I'm male 62. I've had type 2 for 10 years now, but it's controlled by metformin. I have an ache in both my arms for many months now. It's worse when I wake up. Is it because of diabetes?
Hi, Mr. Ganguly. I saw your question. You are having aches in both arms, maybe muscular pains. This is a little bit common in patients who are diabetic itself, and also people who are having vitamin D or B12 deficiency. And I see from your question that you're using metformin. Metformin itself can cause muscle pains for certain people because it reduces the vitamin B12 over a long term. So patients using a long-term metformin always should check about their basically homocysteine, B12, and if needed, if you replace with B12 and homocysteine and folic acid, B12 and folic acid, the pains will improve and you'll have a better sleep. Another thing you need to check is your magnesium levels. Elderly people, magnesium levels will be less. That also can cause muscle aches during the sleep. I think you should consult your physician and tell the symptoms so that he can give you a right advice and give you a right path for that.
Thank you, Doctor. We have a question from Mr. Sri Krishna Agarwal, who is 76. And He says since 32 years he's on oral and Lantus control. He feels muscle cramps and nerve pain with cramps, especially at night, but not on a regular basis. His question is, does he need any medication?
Mr. Agarwal, you have one is muscle cramps and other is nerve pain. Probably you're having some amount of neuropathy because of your long-term diabetes. You have 32 years diabetes. So there's a possibility that certain amount of neuropathy is a set in. First, you need to check about you have any neuropathy and determine it is sensory neuropathy or motor neuropathy. And also check your vitamins, people, because muscle cramps are there. And then accordingly, if you use the medication, the pains and cramps will come down. And also your HbA1c should be checked. Unless your blood sugar is in control, none of the medications will help you to relieve these symptoms.
Right. Thank you, doctor. This is a question from Mr. Anil Kumar Chopra, who's 73. His question is, what is the optimum level of HbA1c at the age of 73 years? After taking medicine, his count is 6.5 most of the time, and BP is ranging from 140, 150 to 75, 70, 75. Your comments, is what he wants to know, what your view is.
Mr. Chopra, it's a nice question actually. If you see from last 20 years, 15, 20 years, the way of controlling sugars and managing the sugars is changed. It is not only blood sugar, but also your lifestyle has to be, your quality of life also should be improved. To see, and you're around 70 years, what I believe is, 73 years. So at this age, any person who is more than 70 years, internationally, what we say is you don't need to stick to 6.5 HbA1c. 70 years, roughly, you keep it as 7. 75, you can keep it as 7.5. And if you're 80, up to 8 is also fine. The reason why we are increased, guidelines have increased the HbA1c is, if you're maintaining your 6.5 or 6 below 7, there is a possibility sometimes you may have a low sugar. And most of the adults in this kind of era where everybody is living single, we are not in a what we call a combined family, what close family with all brothers and sisters and everybody living together. It has become nuclear families. So if you have any episode of hypoglycemia, where you may fall down or you may hit something, because hypoglycemia causes giddiness and unconsciousness, elderly people tend to get more fractures of hips, spine, and all those things. And if they hit the head, they can bleed easily in their blood, causing subdural hematoma. So for these elderly people up to more than 70, HbA1c relaxation has been given, and it has been shown that a little higher HbA1c in elderly people also doesn't have major consequences in future. So you can a little bit relax from 6.5 to 7 also. Keep it at 7, 7.5. I think that should be good for you. You should not worry much about the HbA1c for you.
Thank you, doctor. We have a question from Mr. Satish Kalia, who's 75.
Yeah.
T2DM, type 2 diabetes for the last 12 years, and CKD on 5 milligrams lingliptin, fasting 125, 130, post lunch and post dinner after 2 hours is more than 200, and then falls gradually to around 160. Does it require a review of medication?
Mr. Satish Kalia, at the age of 75 with a CKD, your blood sugars with linagliptin, which is safe in the CKD patients, is more or less in a very good control. Just check your HbA1c to see what is your average sugars in last 3 months. If it is more than 7.5, 8%, then you may need additional medications to control it to little lower level. If your HbA1c is around 7.58, I think you should just leave it like that. You should not be worried much about it.
Right, doctor. We'll have a question from Mr. Shrikant Kulkarni. He says, though sugar and jaggery are both derived from sugarcane, why is jaggery safer?
Nobody agrees jaggery is safer. People in YouTube and other people are telling that jaggery is good and sugar is bad. Both are derived from sugarcane. Okay. And jaggery and sugar, only difference is a little bit of sulfur is more in the sugar, and it is more faster to absorb. the glycemic index, what we call, if you take sugar, it is 100% glycemic, immediately sugar rises. Jaggery may take little more time to increase that sugar, but doesn't mean it is safe. Jaggery, sugar, both are not safe for diabetic people, and it is not definite. And honey also has fructose. To a small amount, some people take with warm water and lemon in the morning. That is can be accepted, but replacing honey with sugar is not accepted and it should not be used. All have sugars which are having a high glycemic index, which will cause increase in sugars fastly, and body has to fight to reduce the sugars, increase sugars, and later part of life, you may need more insulin because of using direct sugars, more direct sugars. First thing is jaggery, sugar, both are equally bad. If you like me to say what is the difference, if you hit with a bigger stone, you'll have a bigger injury. If it is a little smaller stone, you still have injury, which is smaller. So jaggery is a little smaller stone, but injury will happen. It is not safe.
Jaggery is a smaller stone and injury will happen. I think Dr. Nandamuri has been very clear about it. And Mr. Parimal Sharma, I'm sorry, you are still 48. We will not be able to answer the question because there are quite a few from seniors here. We have a question from Mr. Mahavir Hajare, who's 68 and he has diabetes and blood pressure from the last 10 years. He's taking medicines, leg varicose veins are just showing. Is it part of diabetes? And his sugar is 150 and 200 max.
Mr. Mahavir, varicose veins is a different thing, and having neuropathy and diabetic complication is a different thing. Varicose veins is the veins which has to carry blood from your legs to your heart. The valves in the veins are not working properly, which is causing swelling of the veins and fluid retention in your feet. So both are different. It's not a diabetic complication, first thing. So varicose veins can be treated very well easily nowadays with conservative measures like stockings, stent stockings. If your grading of varicose veins is more, that can be done only in the clinical examination and Doppler. Then they may suggest you to go on for laser therapy or surgery, which will relieve you of your symptoms. I think you should consult your physician and a vascular surgeon to get relief from your varicose veins.
Right. Thank you. We have a question from Ms. Sheila Kohli. She says, I'm not diabetic. She's 76. I'm not diabetic, but I get itching in my feet and legs sometimes. I have been given Pregabel, which has given me swelling in my feet, for which I have been given Diator. Your comments, doctor.
Okay. Ms. Sheila, see, you're not diabetic, I understand. Itching of feet is a different problem. We need to find out, is it due to any allergy or dryness or any other cause, urticaria or any skin disease. You have been given pregabalin. Yes, it has a known side effect of fluid retention in your feet, causing swelling in the feet. So while using pregabalin, you're using Diator to reduce that swelling. That is not right. Stop Diator, stop pregabalin because it is causing you swelling in feet. Then you may not need Diator. So it's like eating a lot of sugar and taking more insulin, more and more insulin. So pregabalin has swelling. So you're removing fluid with Diator. So removing Diator, fluid with Diator can cause electrolyte disturbance. That also can cause your itching and legs, itching of feet and legs. So first thing, go to your physician, replace pregabalin with any other medications which you needed for you, and stop using Diator unless it is necessary.
Right. Doctor, which is a question from Shamla Ravi. Which is safer to have, rice or wheat? They say now both are the same as far as glycemic index is concerned.
So rice and wheat, I don't agree it is glycemic index is same. If you're eating rice which is having a lot of, it's not milled or polished very well, that is from the farm, just remove the layer of husk and then eat. That's a pure brown rice, what you call it. Then you may say that it is glycemic index is near to the wheat. There is a little difference on glycemic index, but the important point is both can be safely had, depends on what is the amount you are having compared to your what is your physical work. So what is the amount of carbohydrate needed for your compared to physical work what you do. If you are sedentary, and you're eating like a person who carbohydrates, like people who are working manual work, like manual laborers and all, you will not, glycemic index will not, low glycemic index also will not help you. So yes, all of us are telling that rice and wheat are more or less same, depending on how much amount of rice or wheat you're taking. Equal amount of carbohydrate intake from rice and wheat will be okay. So basically what you need to do is don't overeat your carbs. That's important.
Right. Thank you, Doctor. I have a question from Mr. Kaushendra Singh, who's 65. He says he's diabetic for the last 10 years, under control with medication, and HbA1c is 6.8. He says, I'm having stretching pain on both my buttocks when I wake up, with lower back pain, which reduces by the day but remains throughout.
Okay, his HbA1c is fine. Your diabetic levels are fine, but your lower back issues can be a problem in your lower lumbar vertebral, any nerve compression or sciatica, bilateral, and also some people who are diabetic and elderly people slowly lose their muscles all over the place. And if you lose more muscle in your gluteal area, that is buttocks area, there is a tendency that you will be, if you are sitting for a long time, you are pressing your nerve because your muscle cushion is gone. You will be directly pressing your sciatic nerve when you're sitting for a long time. That can also cause this kind of pains. And second thing, what you need to see is if you're, for some people, you're having bilateral pain, for some unilateral pain, people have habit of keeping big purses in your back pocket and sit on it for long hours. That also can cause your sciatic nerve compression and causing nerve pain and buttocks pain. So if you're having heavy objects in your back pockets and sitting for long times, please avoid it. Anyone, irrespective of diabetic or non-diabetic.
So fat wallets are a no-no.
Yeah.
Fat wallets are a no-no.
Hot wallets are good, but don't sit on it.
Don't sit on it. Very well said, Doctor. Doctor, this is a question from Marjorie Fernandez. She has two questions. One, the number of diabetics has increased a lot, partly because of the limit of sugar has been reduced over the years. This is partly due to pharma companies wanting ever increasing demand for their medicines. Is it possible to reverse at least? So the first is just an observation. Is it possible to reverse at least or reduce the extent of diabetes by changing one's lifestyle, diet, etc.? There are a lot of the number of websites, example, which is given one, which claim to reverse diabetes. How reliable are these?
Okay, let me come to your first question. Yeah, diabetics levels, limit of sugar has been reduced over a period of some years, and people feel that it is due to pharma industry manipulations and all those things. I don't want to go into that, but what, as a physicians, what we can see from the larger studies of 10 year, 15 year studies is the level of blood glucose level where we get less complications. That is a level which you're trying to tell our patients to get into it. That's a simple thing. So I'm not talking about numbers. Second thing, sorry, 1 second. Second question.
The second question, which he has.
Yeah, I got it. Is it possible to reverse? See, reversal of diabetes is a misnomer. First thing, understand it. Once a patient is diabetic, he'll always be diabetic. Okay. Reversal cannot happen. However, we can definitely control blood sugar with your lifestyle change, diet, and exercise without medications. Controlling blood sugar levels into normal levels without medications, stopping medications by lifestyle changes, doesn't mean that you're not diabetic. You're still diabetic, but you're controlling without any chemicals, that is medication. That is good to do. There are a lot of people who are promoting that. I'm happy to do that. But don't think that if you lose some weight, your blood sugars will come down. That doesn't mean that you're not diabetic. You are in a remission. So if you start eating normally after you have been in a program like some mentioned you too, for 6 months or 1 year, and you lose your weight, your HbA1c comes, for example, from 7.5 to 5.8. It is into pre-diabetic level. then we start eating as normally as before, again the HbA1c will crop up. So fundamentally what I'm trying to say is, yes, we can control blood sugars without medications by diet and lifestyle changes, provided you sustain that changes over your lifetime. You cannot go back and eat again as normal person and say that I got diabetes again. Whatever, once you're diabetic, you are always diabetic. How you control depends on a person to person.
Right. Thank you, Doctor. We have time for, I think, just two more questions. We have a question from Meeta Bhavsar, who says, what care should be taken for Caesar patients having diabetes? And she says, she's prescribed with Lametec 100. And one more question she asks is, can steroid-induced diabetes be reversed? So the first one is on the seizure.
First question, seizure. Okay. A person who is having seizure disorder also has diabetes. Make sure that the person should not have a low sugar. Because a person who doesn't have seizures also, if he has low sugars, they can throw seizures. So avoid hyperglycemia, first thing. Second question is, can we, sorry, how is that? What was the second question, sorry?
Second question was, sorry, 1 second. I have also exited the thing.
I am prescribed Lametec 100.
Yeah. So what care should be taken? That's okay, doctor. I think the second question is not something which we were looking at anyway.
Yeah.
Can steroid-induced diabetes be reversed? Is what the question.
Okay, steroid-induced diabetes. After you stop steroids, most of the people get normal sugars. But a person who gets steroid-induced diabetes has high incidence of developing into diabetes over a period of next few years. 50% of patients will become diabetic. So you should be on vigilant, regularly checking your sugars and changing your lifestyle so that you will not be needing medications. Not all steroid people who use steroids will get diabetes. That we need to understand.
Doctor, we have a question from Benu Wagira. Says, I have diabetes for 15 years, which I have been maintaining by diet, exercise, medication. But of late, over the last few months, my sugar levels are higher in spite of following the same routine. Most importantly, I have no symptoms to know that my sugar level is higher. It's only after testing I come to know, which is, what is it about? He's 60 plus, and he says diabetes runs in his family from the father's side. He's not overweight or sloppy and has an active lifestyle.
Mr. Binu, you have been maintaining your sugars last 15 years for your diet and exercise. You have a family history of diabetes. So over a period of time, if you have diabetes and maintaining with lifestyle changes, slowly the pancreas secretion for everybody will reduce over a period of time. The insulin production will come down. So your sugars will crop up even you're doing the same things for so long years. And if that is the case, check your insulin levels, how much your pancreas are working. And if needed, don't stay stuck at lifestyle changes and see that another 3 months or 6 months or 1 year we'll see with the lifestyle changes, even though your sugars are high. Add basic medication to get them into the normal levels. I think you should do both lifestyle and medications if your sugars are going up.
Right. One last question, doctor, from Katie Dadanchi. Doctor, is diabetes hereditary and does it pass from grandparents to their children and grandchildren?
The simple answer is yes. If your diabetes runs in the family, and it is more in the people who doesn't run also. That means if you don't exercise, you will be more prone for diabetes. It still runs in the family. To avoid, keep running.
Right. Thank you very much, doctor, for a very detailed presentation and responding to quite a few questions that we've had. We've responded to over 20 questions here already. There are some which are left, but we found them repetitive, and two of them were too much into medicines. Doctor, it was very good that you responded to so many questions and clarified so many doubts. Thank you very much once again, and thank you to your team at Yashoda Hospitals to have facilitated this. Doctor, if you don't mind, I'm going to take a minute of yours. I'm going to request our producer to play the video of our 4th anniversary issue.
Yes.
And Firoz, can you run that? So this is our 4th anniversary issue, which has just been out today. And we will play the video, give you an idea of what the contents are. As always, the magazine is available online. It's not a physical copy, and you can just buy it. You don't have to buy it. You can just read it. It's available free of cost. As I see, there's a tech edge So this is our 4th anniversary issue. Some interesting topics, some interesting issues that concern seniors, other than, of course, the one on Rekha. And we have some top writers like Bachi Kakaria, Urvi Piramal, who is written about her trip to Ranthambore. So do have a look, enjoy the magazine, and do let us know at what you think of the magazine. Our email address is the same, editor, editor @seniorstoday.in. You can write to us, and do remember, we're very thankful that Dr. Dilip Nandamuri has been here, spent an hour with us today almost, and then we will be back once again next Saturday at 5 p.m. with another session of Health Live at Seniors Today. Thank you very much once again, Doctor, for being here.
Thank you, Pradhiman. Thank you for the opportunity. See you around.
Subscribe now and press the bell icon. Never miss an update.